Again, my name's Scott Rosen. I am founder of the HR department of the Awards 25 years ago. And we're excited to present our kickoff event today featuring VNAO Health Group. And I will get to those introductions, but first we just have some things that we'd like to do before we turn it over to VNAO. So we're going to start off with a little bit of background, and then we have some key sponsors and special introduction by SAP, and then we'll start the presentation. So we'll go into a little bit of background about the program. So I founded it in 1998. And my original goal was to, because I had been in corporate HR and I had also been in operations and just kind of had that feeling that HR wasn't getting the recognition that it deserved. So I decided that a program like this would be a good way to recognize HR and the function and the people that run it. And we wanted to raise the bar, and we feel that we've done that over 25 years, had hundreds and hundreds of companies recognized, and feel like we've achieved that. So I want to welcome our hosts today, including myself and the Rosen Group. I'd like to give a shout out to Challenger Gray and Christmas and our partner, David Panett. Who is these are my partners that help run the program and make strategic decisions. Marsh & McClellan Agency Tryon would be John Ford, and Salveson Stetson Group would be John Toohey. So thank you all for helping run this program. Next, want to recognize Kelly Benefit Strategies. They're going to have a moment to introduce themselves shortly. And also Comcast Business, which will also have a moment shortly. In addition, we have several other sponsors that have helped and make this a great program. We have Contemporary Staffing Solutions, Evan Violet. We have Double Star, which would be Tony Trasati. We have Emerson Group, which would be Bill Emerson. We have HR Computes with Chris Cole and Morris Yankel. We have Hub International with Arthur Howard and Michael Jacobson. We have Meditation for Leadership with Steve Cohen and Renee Pavarotti. Salveson Stetson, Marsh & Mac, Tryon as well, and also Challenger Gray. So thank you all. Really want to give a big shout out to the sponsors, and thank you so much for your participation and support. As far as the awards are concerned this year, applications are due on August 26th. So if you're thinking about applying, we encourage you to apply. We'll talk a little bit more about that later. The finalists will be announced on September 15th, and then the event itself will happen on November 9th. At the Crystal Tea Room in Philadelphia. We had probably about 250 people there last year, HR leaders. So please try to either apply or join, and you can reach out to us if you have any questions. We'll give you that information later. So John Gallagher is here with us, and he's the Enterprise Sales Manager from Comcast Business. We're happy to have John and Comcast Business as a wonderful sponsor. Obviously, you know the Comcast name. John, do you want to say a few things about your division or group and anything else?
Yeah, sure. And thanks, Scott. And very excited and honored to be a part of your program, and looking forward to the awards again in November at the Crystal Tea Room. It's it's very enjoyable. Some powerful speakers you had that still reminisce with me today. So I'm excited to be a part of it. As Scott mentioned, I'm an enterprise sales manager for Comcast Business. We are here in the Freedom region. I'm actually in transit on the way down to the Comcast Tech Center, which is very exciting to take a customer through the building and through our lab about the different services and products that we're offering, Metro E, SD-WAN, and we're a holistic, full solution partner. And what we're doing here today with you folks, ever need a hand, want to reach out, more than happy to take you a tour downtown. It's not awful. It's a beautiful site from Ralph's Cafe on the 46th floor of the Comcast Center, and looking to build a partnership. As you can see, Comcast is a very community-oriented organization. It's so exciting to be part of it. Veteran-centric, so a lot of great things, a lot of partnerships, and we're here to help you and your IT staff make life a little bit better, a little bit easier, and as productive as possible. So thank you for the time, Scott. Wish you all a beautiful day.
Thank you, John. Thank you very much. And next we have Kelly, and we have Dylan Atkinson, who's account executive for Kelly Benefit Strategies. Dylan, you want to introduce yourself?
Yep. Thanks, Scott. Good morning, everyone. So I'm Dylan Atkinson, and as Scott mentioned, I'm an account executive at Kelly Benefit Strategies. And we're proud to support the HR Awards once again this year to help just put a spotlight on the phenomenal HR leaders and teams in our region. Since 1976, KBS has been providing comprehensive employee benefit solutions and offering brokering and consulting expertise. And today we serve thousands of businesses, and we're focused on helping our clients save time, control costs, and ultimately maximize the value of your benefits investment. And so we're just privileged to partner with many of the leading employers in Greater Philadelphia area, including many of the former HR Awards winners. And we love supporting this event and the broader HR community. So thank you, Scott.
Thank you, Dylan. Appreciate it. All right. And then next, if we were able to get Dan Healy on the line, who is a previous winner. SAP's actually been a long-term partner of the awards program. They've won, several years in several different categories. So we're thrilled that SAP is going to host an event in the fall. And Dan, if we have you, try to get you in there to just tell us a little bit about what's going on.
Scott, thank you so much. I'm here proudly and excited to be a part of the program today, and just want to put a plug in for our upcoming event in collaboration with the HR Department of the Year Awards program. Currently in my role as head of customer success people, which is our sales and customer facing organization at SAP. Just a little bit about SAP. We're a German-based software company. We have 107,000 colleagues in over 140 countries around the world. And we're very, very proud and honored that about 2/3 of the world's GDP touches an SAP system, and we're mission centric. Our goal is to help the world run better and to improve people's lives, whether that's government entities, whether that's hospitals, universities, supply chains, et cetera. One of the things that we're excited about is, Scott, as part of your mission and vision when you founded this program, the idea when you created this over a quarter century ago was let's recognize our HR leaders and for the amazing work that they do, and how this could be a way to share best practices and also reward and recognize. And SAP has been a past winner. We'll be looking forward to the event this fall, but we're also looking forward to hosting an event in Newtown Square at our SAP headquarters. And we'd love to formally invite our friends and extended family members on this call here. The event will encompass really who we all are as HR professionals in the Greater Philadelphia area. At SAP, again, we've received awards, but we want to be a part of some best practice sharing, some mind share. And, we're excited to be a part, Scott, of your vision in hosting this event, and more details will come. So thank you, and I'll turn it back to you.
Thanks, Dan. Thanks for the reminder that it was a quarter century ago. I really appreciate that.
We're all younger and wiser.
Okay. Thank you, Dan. We look forward to it. And let's see. So, all right, we're gonna get going here. VNAO Health Group won last year's HR Department of the Year award. Some of you probably know about VNA Health Group, some may not. So maybe we'll learn a little bit more about the organization, but also learn about what Bet Rosa, CHRO, and her fabulous team have accomplished in the HR function, which is a lot. So I'm proud to introduce Bet Rosa, CHRO, Jean Carlin, VP Labor and Employee Relations, and Adam Chandler, Director of Learning and Development and Talent Acquisition. And I'm going to turn it over to you guys. And we are going to welcome questions. You can feel free to put them in the chat if you have questions as we go along. We don't have to wait till the end, and would encourage you to learn about what their successes were. So, Bet, I'm going to turn it over to you now and let you take it from there.
Thank you, Scott. Good morning, everybody. Happy to be here with you. Honored, actually. We were thrilled to be chosen the Department of the Year last year, and so we're going to share our experience with you. And afterwards, if you're interested in talking with us, you can just let Scott know, and we'll be happy to connect with you. Next slide, Gina. You can keep going. All right, let me just tell you a little bit about Health Group. So VNAO Health Group is kind of like a parent company. And what we do is we do home health, hospice. We also have Children Family Health Services. It does kind of community health grants based in Monmouth County. We also have four federally qualified health centers that we run called community health centers. And we are, for our home health and hospice, we are located in most of New Jersey, probably like 75% of New Jersey counties, Ohio, and Florida. We're our largest nonprofit provider. We also have visiting physicians. The partnerships we have around home health are with large hospital systems. So in New Jersey, that's RWJ, Barnabas, and Englewood Hospital. In Florida, it's the Cleveland Clinic. Yeah, Cleveland Clinic, but it's in Florida. And we also have our Metro Hospital in Ohio that we're partners with. So everything from an HR standpoint is centralized, and then we support the businesses as business units, similar to like a large corporation was, but we're only about 2,400 people. Our journey was when I was hired about 4 years ago to take this organization that grew up as a nonprofit, kind of like a mom and a pop, kind of the boots on the ground to try to help underdeserved populations, and then grew up to this big organization that has multi-state operations, and take it from transactional to strategic HR, and how do we help the business deliver value every day and continue to provide services. Next. So the question really is, why did we want to apply for the HR Department of the Year award? I will admit, just to hang with my friend Scott, I was in the audience 25 years ago when he first did the inauguration of this. So it took me 25 years to win the award. So that says something. It's a pretty prestigious award. But the reason that that we really applied for it was that in 2020, everybody went internal, right? We all went internal, which working really hard to try to, help our organization survive, help our people stay safe. And, that was a historic where, you couldn't look outside to get best practices because there weren't even practices, and you kind of had to be making things up. So you tended to go more inner thinking than external and sharing. So we wanted to kind of have a validation. Did what we were doing, was it fantastic? Was it historical? Was it good? We had nothing to compare it to. So we did it for that reason, just to compare ourselves and see how we were done. The other thing that happened that was kind of unexpected was when we went through and prepared the presentation, we realized how much we really did and how flexible and how, the 25 years or 30 years or 40 years, however long you've been in HR, that is prepared for this day. So it really helped us, because then we went and got even more face-to-face internal customer feedback than we had ever gotten, and really understood how we impacted the businesses, which I think makes our team, much stronger today. Next slide. So this is just kind of depicts, what do I mean from transactional to strategic, right? And so we had all of the things that we were doing, such as paying people and changing, their benefits and enrolling them in benefits and recruiting. But the strategic piece for me that was missing at VNA was, how does that matter to the business? Why does the business care, right? What's the engagement level of the employee? So those are the questions that we started asking versus, are they enrolled? Did they get enrolled in day one? Next slide. And so our strategy, and this is the strategy that we had 4 years ago that kind of laid the groundwork for this, was basically to keep it simple. Everything we do has to have business alignment. And it has to know what the strategy of that business is and how we can move it forward. And we connected with the strategic plan, and our strategic plan had 3 pillars: people, very important, the quality, experience, and the innovation. Under people, though, it's recruit and retain to win. Engagement equals excellence. We are a learning organization, and silver success, meaning we want to keep more and more clinicians instead of retiring as per diem, so we don't lose workforce. And then back to the basics. So build a solid foundation in HR and really focus on that customer service. Next slide. Okay. When COVID hit in 2020, all of that big strategic plan, it didn't matter as much, right? Because we needed to have an interim strategic plan, and that interim strategic plan was what we focused on all of them in 2020. And the first one was to keep the employees and our patients safe, right? Care for the health and safety, make sure that we had PPE, getting on eBay and playing eBay wars to try to win PPE. If you remember early on in the pandemic, it was very crazy. Continue attraction and retention of talent. Even when in 2020 we had to do some temporary layoffs, we said we're not laying off talent acquisition. We're going to keep going. We're going to keep building that pipeline, keep finding the clinicians to keep the business open, which is the next one. And then employee engagement, health, and well-being. So those were the 4 things that all of our leadership focused on. So this was the first time where HR and business strategy became one. So what I'm going to do now is hand it off to Gene Carlin, who's a member of our team, and he's going to talk to you about the experience we had for the award process.
Thanks, Matt. Yes, I wanted to review our experience with the awards process and what it allowed us to do as a team, and our experience with the leadership, Mark Spool and Scott, your influence and impact on how we framed our application and our presentation to the judge panel. So as Bet mentioned, as we were in the trenches serving our population, we sort of had our blinders on to what we were accomplishing as a team, because we were just focused on getting the job done. So this experience leading up to the award gave us an opportunity to reflect on our accomplishments as a team and look at some of the things that we were able to drive with our business groups and our leaders, and frankly celebrate our successes. Take the time to really reflect on what an accomplishment we made during these challenging past months. What we also wanted to make sure we tied it back to metrics or outcomes, what we were able to drive with our respective business units, and how we were able to tie it back into results and what we were able to move forward. And it was important that we reflected that in our application and also in our presentation to the judges, just to have a measurable outcome tied to some of these key strategic initiatives. With the application and guidance support, as I mentioned, from Mark and Scott and others, it really helped us think about that impact lens, not just to share accomplishments, a list of accomplishments, but tied back to our business strategy and what we were able to move forward and what metrics were we able to look at that we could correlate back to HR initiatives. So as we looked at also giving a reflection of our outcomes and what we were able to drive. We shared specific examples within our business units where we were able to assess what the challenges were for a particular business unit and bring forth an HR solution. In our Ohio operations, we were having turnover with the nurse population, and we decided to layer in a retention and attraction bonus for the new, not only the new hires, but the existing employees, because we were getting feedback. Hey, we see all these sign-on bonuses for your new hires. What about us? We've been working hard for you. So we took that to heart and decided to roll out a retention bonus as well. And we were just looking to share some specifics of that and our accomplishment with that team. And we ended up getting 93% of the population to commit to 2 years of staying with us with this retention bonus. And then as we looked at how can we also have some stickiness to our programs and our employees wanting to stay here and stay committed and stay engaged, we wanted to do regular check-ins. So we launched some engagement check-in activities, and we're able to see some results in a decrease in terminations and increase in retention. So as we were framing up our experiences, we wanted to have some metrics tied to our results, and we're able to produce that with this particular scenario. Next slide. So we took it a step further. As Beth mentioned, our leaders were able to give us feedback about how HR was intersecting with their business line and what we were able to accomplish with them. And it was nice to see that, again, we don't always reach out for this feedback. And we did a wide cross-section feedback distribution to get a sense for a leader in Ohio, a leader in home health, a leader in hospice, a leader overseeing our visiting physicians. And they were able to give us some specific feedback on where they felt HR hit the mark and how we were able to help them drive recruitment, help them be innovative in finding nurses, help them reach other clinical talent through some dynamic recruitment strategies, partnering with Adam and team to come up with creative solutions to find the talent. As I mentioned, that retention program. So our VNAO of Ohio, and this is just one example of many, that we were able to receive feedback from our leaders. What are they saying about us? What were we able to help them accomplish in these recent months? Next slide. So I happen to have oversight for our labor relations activities across our footprint, and we have 7 union contracts, and we were wanting to share in each of our functional areas some successes. You'll see to the left of this slide that we attached our accomplishments to our business strategy. And we had a 3-year strategy tied to people, growth and innovation, quality and experience. And we correlated each of our initiatives to mapping it back to our overarching business strategy. So that's just a format we chose to present where we were tied to our overall business strategy. In labor relations, we took a historically negative relationship with our unions and got out of the business of grievances and arbitrations and worked collaboratively with them through a lot of labor management meetings, a lot of partnering to find solutions to the pervasive problems, transparency and communication, making them aware of everything we're doing to navigate the pandemic, and really turning it into a positive relationship from what was very adversarial in prior years. And we were able to negotiate with them some add-ons for our clinical population as they were serving COVID positive patients and the like. And as we look back at our results, and I really wasn't focused on this as much, I realized that I had a metric of reducing grievances by 70%. and that we were able to enhance some consensus building through an interest-based approach to our labor management meetings, having reached consensus on some problems and do solution building together. So I was really pleased to share this, and throughout our presentation to the judges panel, we kept sprinkling it with some accomplishments and metrics and outcomes, how we were able to drive enhancements to our populations. Next slide.
Gene, can I jump in with a question?
Sure can.
And this is really to anybody on your team. Bet was talking about, having been there sort of at the beginning of the program. And then, obviously your HR group has accomplished some very significant things. What was like sort of the timeline for, I'm sure your HR department has been effective for a long time, but, as you've developed your function, is it recruiting members of the HR team to better accomplish certain things? Was it you guys learning as an HR team about, more sophisticated ways to implement these types of programs, or were these programs sort of in existence all along? It's just like now, you're getting more recognition for, like, how did you kind of evolve into the team that you have right now?
Great question. And I'll have Bet and Adam add to this, but that journey that Bet was mentioning, transactional to strategic, didn't happen overnight.
Right.
So early in Bet's leadership, she was very instrumental in getting the key players in place, key leaders in the functional areas, so that we could push forward excellence in those areas. But that had to be also combined with looking at technology and how we were utilizing our systems to attract talent, to monitor data, to manage enrollments, to track timekeeping, track records. We're a very compliant organization because of being surveyed with accredited bodies. So we had to make sure we had everything in place. And then in the recent pre-pandemic, we didn't really have a fortified employee health team. So we had to be nimble and create a team structure and presence for our organization. And Bet was able to get the players in place and put some metrics and measurements and education. And then Adam had to also fortify his learning and development activities to map to some of these initiatives that were very new. So Bet, I'll have you add to that and talk about that journey that didn't happen overnight.
So luckily we started in 2018. In 2018, I used a little bit of science and a little bit of art in building the team, right? I used a culture index to survey. Everybody was there when I first came and met everybody. So I knew my whole team, just like you would a football team, what are their skill set? What are they good at? What are they not good at? I had all of that information. And then once I figured and listened and figured, well, this is how we should design, I was very purposeful in, making sure that the leaders that I surrounded myself with had different skill sets to bring together. So once we had that, we had people that were, leaned heavily strategic thinking. We had people that leaned heavily with, detail, people that leaned heavily with relationships. And, so that part, along with the experience and knowledge, set up a team that was really good at collaborating. And when you're really good at collaborating with each other, you can figure out anything. And that's what we needed. So I kind of feel like very lucky that we got to start in 2018 because we had the pieces in place to be able to do what we did and to be able to collaborate and build anything that we needed in 2020, even if it didn't exist, like the employee health. Adam, did you want to add anything?
Yeah, I think you hit on, Bet, that, so much of this revolution in HR with the VNA is relatively new, and that's because of the leadership that's been installed. So, Bet, I think you started in the summer of 2018. Our director of HR operations, Femi Malik, and myself, we started around December, January of 2018, 2019. Susan Gilliard, director of employee health, clinical education, infection control, started in January of 2020, just before the pandemic. And then quickly, her role quickly evolved into something greater, from a clinical educator to, all of the functions that I just mentioned. And we didn't stop after the height of the pandemic. In fact, one of the newest members of our leadership team is an HR manager of analytics, Kelly Griffin, who just started around Labor Day. And, we're looking at new trends and new ideas to fortify HR and then, support our business. And we recently accepted a transfer from another part of the business who had a different expertise to drive our diversity, inclusion, and health equity campaign. So, even though we submitted this application last fall, we're an ever-evolving team that's always partnering with our larger cross-functional leadership team and trying to identify new opportunities to, yes, partner with them, but also to, again, fortify our service model.
Thank you, guys. Really appreciate it.
And also important to us is to monitor and track our successes in serving our employee population. And integral to that was responding to the multiple HR questions that come into our various functional areas. And we decided to roll out a centralized ticketing system where we could track and monitor the turnaround and really route it to the subject matter experts for the areas that the question addressed. And we were able to decrease the turnaround time and obviously enhance the quality of the answer because the subject matter expert was responding to that and also educating or sending along information that would be helpful to the employee. So we took some of the confusion around a centralized email box, if you will, and moved it to technology so that we could track and monitor and really have a pulse for what employee concerns and questions are. And then with those trends, we're able to map it to communication strategies, to the gaps of knowledge that our employee population may have or where we need to do a better job of communicating. We were able to see that trend within the ticketing system. So just another example of where we're trying to be innovative, move things forward. This isn't highly savvy, but it was something that we needed to have our eyes on and measure. And so we moved it to a ticketing system.
It gave accountability to us to make sure that we got people answers.
So I'm now going to turn it over to Adam Chandler, and he's going to talk about the areas he had oversight for and what we were able to share and what we accomplished in recent months. Adam?
All right. Thank you, Gene. And thank you, Bet. Just a quick disclaimer, housekeeping disclaimer. If you hear the whirring of a laundry machine or a washing machine in the background, I do apologize. My 13-year-old son decided to put up a laundry load before he went to school, but I have to keep telling myself, at least he's a 13-year-old who wants to do laundry. So we'll call that a hashtag parenting goal achieved. All right, now back to our regularly scheduled program. One of the things that I think that resonated with our team was, making an impact, doing something that was kind of unique and being able to measure it. And when we had a consultative discussion with Mark Spool, who was kind of our tour guide in making this application a success, those are the things that we were really thinking about and harping about as we were putting this application together. So as the head of talent acquisition, I realized that many companies that apply for this award have a talent acquisition team, and they are managing the day-to-day functions of finding candidates, working with their internal clients on evaluating that talent and negotiating salaries to hire them. So that's the everyday. And we were thinking, what are some of those unique and impactful activities that talent acquisition does that will seriously help the business. So I go back to, even before I was hired, a report that I read from the New Jersey Nursing Association about the shortfall of nurses that was going to hit 2020. And that number was 40,000. 40,000 nurses were going to be required across all different nursing disciplines. So any organization that hires a nurse, they were going to be impacted some way by this massive shortfall. And that included home health and hospice. So, one of the things that we had bandied about when I first started was a nursing residency program, because we knew we needed to build the pipeline. There had to be a future talent pool that was eventually going to assist us in creating a new workforce. So we partnered with the Rutgers School of Nursing to launch an out-of-hospital nurse residency program. It was a calculated risk on our part because prior to 2019, the organization really did not have an appetite for bringing in junior nurses. And by junior nurses, I mean nurses who just graduated with their bachelor's of science in nursing, had just taken their NCLEX, which is the boards, the test that one needs to take in order to get their nursing license. And the reason why it was risky is you can't just put a junior nurse in somebody's home and expect them to be effective. Furthermore, in order to make those nurses more effective, they needed to be paired up with somebody called a preceptor, which was a much more experienced nurse, probably a very good mentor, probably a very good educator, and very well skilled. And in order to pair up that preceptor with that resident, you would have to take that experienced and well-skilled nurse out of the field. Big, big risk. But we decided to launch this program on a very small scale with 6 residents. We know that 6 residents wasn't going to solve a 40,000 nurse shortfall problem, but we needed to prove the model internally. So we started with the 6, 5 made it through the program, and we learned very quickly that these were pretty sharp characters. And within 5 to 6 months, many of them were fairly independent to manage a regular caseload, meaning they were able to go to patients' homes and handle regular visits without a high intensity or severity of skills required. But as they required, newer and deeper skills, we were going to provide them with those experiences. So very happy to report that 5 residents are active and independent with their own caseloads. We did another mini version of the residency program in 2021. The pandemic affected those numbers, but very pleased with those 2 residents who joined us, because just by happy accident, they were assigned the Monmouth County-wide vaccination program, and they learned leadership skills and ended up being site captains for a couple of our vaccination centers. So again, any advice I would give to an organization that is applying for this award is think impact, think unique, think about something that you're doing that is different than the everyday. Next slide, please. And very happy to report that this program was validated by way of Chief Learning Officer Magazine, which is an international publication that covers the learning industry, especially on the leadership side. We won the gold level award for their Learning and Practice Awards for business partnership, and that means collaboration with other parts of the business. So this wasn't just an HR initiative, it was an initiative with the cross-functional leadership of our organization. On the talent development side, again, trying to fill gaps. So one of the things that we identified was a gap in developing next line leaders. So we had an executive row that was pretty well versed in leadership, but we had a lot of high potentials or emerging leaders that just weren't getting exposure to not only management basics, but also what it means to be a leader in a very challenging environment. And, in our case, that means the direct patient care space, which of course was further complicated by the pandemic. So again, there's nothing like a solid partnership. Again, we partnered with Rutgers, but this time it was the RWJ School of Medicine. And we offered a 7-month leadership learning program where there was a cohort that started out with 14, but 12 employees made it through the program. There was representation from all different parts of the business: clinical, non-clinical, IT, HR, philanthropy. So the entire organization was represented, and that also included all states: New Jersey, Ohio, and Florida. There was a nomination process. It included the tool that Beth referenced before. That's the Culture Index, to make sure that we had a variety of skill sets and potential leadership strengths represented. And we put them in cohorts, and it was done all over Zoom. And our emerging leaders were put into breakout rooms where they could identify problems in general management, but also in healthcare leadership. And the program culminated in a capstone assignment that many of these graduates of the Elevate program are working on now. These are extremely experiential and extremely relevant issues that they're working on. They're not just like book reports that just live in a vacuum. They're actual deliverables that these leaders are working on to deliver to make the VNA a better organization. So we're very proud of this program because, yes, it filled the gap in leadership development, but it's also ushering in a new era of allowing a new group of leaders to identify problems and work on them themselves. Next slide, please. And in general talent acquisition, I think, the measurement is so essential, and, showing the impact of what you've done year over year. But I think this all goes back to what Bet mentioned at the beginning of this talk, and that is, making decisions in the early game in order to have victories in the end game. So that decision was in 2020 to not turn off the heat with our recruiting efforts. So we did not let any of our talent acquisition specialists go. These are our recruiters. In fact, I think we made a stronger investment both in our digital resources and our offline resources to continue to pipeline talent. And as a result of that investment, you see the numbers here. We were able to keep the lights on as far as our business. We actually temporarily changed our model to become not just a home health and hospice organization, but the standard home health organization that provides direct patient care to COVID patients, if that were the case. And there's some employee health information, I think, maybe in a future slide that we can reference to talk about how we're able to do that and still keep our employees and our patients safe. So again, we're able to keep those jobs filled, keep those numbers high by way of pipelining. So I think that was a very worthwhile investment. So Gene had mentioned the importance of testimonials. We spend a lot of time with our chiefs, with our leadership, and we really can't do what we do without them. Not only do they help us to greenlight some initiatives, but we also lean on them to participate in many of the very innovative initiatives that we're offering. So, again, for those of you who are putting together your applications, definitely hunt down those testimonials because they add a flesh and blood dimension to what it is you're doing. And again, they further validate all of the work that you're doing in each of the different swim lanes of HR. So this is Ellen Gussick, who is our Chief Nursing Officer. And here she talks a little bit about the partnership we have with recruiting and some of the COVID-19 related efforts, again, to keep the business flourishing. Next slide, please. Wendy Ebner is also a chief. She is the head of nursing for the South. And when we say South, that includes South Jersey as well as Florida. She's also our chief integration officer. So whenever there is a merger, acquisition, or a joint venture, she is the point person that leads that. And of course, HR takes a front and center approach to when that happens. So here she talks a little bit about our creative recruiting strategies, and also some of the collective bargaining victories that we've had as well. So I will now pass it back to Bet.
Okay, thank you, Adam. So also under HR in our company is employee health, infection control, and clinical education. So as you heard people mention, we had a small employee health team, but we had to really build it up really quickly for daily health screenings, COVID testing, all that kind of stuff. One of the things that we're really proud of is with making sure we had the PPE and not worrying about the money that it costs is we prevented 100% of work-related COVID-19 exposures to our frontline COVID SWAT team. What do I mean by that? Well, home health never served infectious disease patients and taken them home before, right? But it was very, very critical to our partners. Their partners came to us and said, listen, in this first wave, our hospitals are going to get overwhelmed. The only way we're going to be able to survive is if you can get some of these out of our ER and if you can get some of them out of the hospital and you can care for them home. So we took oxygen home. We made all of that happen. And we were very, very proud that our clinicians who ran towards the problem and not away from the problem were willing to go into homes with full geared head to toe PPE. And we made that proven so that we could be part of the solution to this pandemic. But still, number one, you saw on the slides, keep employees and patients safe. Next slide. The other thing is, diversity, equity, and inclusion is very big for us. We've taken a major step now and have actually a board committee as well as an employee council. So we're being more purposeful about our diversity, equity, and inclusion than we have been before. But even before to that, our makeup of our clinicians that serve our community are pretty well representative of all the different types of patients that we might come apart. What we are now trying to take is to how does that translate into culturally competent care? How do our people know when they go into a home to what questions to ask to make sure that you are respecting the culture and the beliefs of that family while caring for the patient? Next slide. And then, we found out early on, right, is if your employees are happy, they treat your patients happy. So that employee engagement for us, and we're a Gallup shop, so we use the Gallup Q12 to assess on an annual basis with additional pulse surveys to gauge our employee engagement, which then there's a direct correlation to patient experience scores as well. Next slide. This is just for your reference. Here's the 12 questions that they ask in the Gallup survey. And they go from, things about, do I have the tools I need? Do I know what's expected of me? All the way up to, do I have the opportunity to learn and grow? This is an example of, how did we improve? So you see in 2018, our grand mean score, which is, it takes all of those questions and makes one rating out of it, increased to 4.07. That's a huge jump, especially in a time where, you're making a lot of changes. So this gets benchmarked against healthcare area, and the 2021 results that we did went up. So even when other healthcare organizations were seeing a downward trend with the pandemic, a little bit of engagement, a little bit of burnout, we were seeing it go up. And we believe that it's because of the mission serving people, and that we were part of the solution. But this dashboard is very, very key to us and employees, because we also can break this down by manager, and we can see what managers have low scores on, making sure that people know what's expected. And then we can then direct HR business partners and Adam in the learning and development with how can we help those managers, get better? How can we help them with development? Not a penalty system, but a development system. And then one of the other thing that we measure in Gallup and other ways as well is the importance of well-being. So employee safety and health includes your well-being, mental health. And so we measured this as well to make sure that our people aren't struggling and that they're doing well. And again, we can also see where the red parts of the organization are, where maybe they might be stressed out, and then we can send help. So it's really more of an intelligence tool than a hip, hip, hooray, we are good at Gallup, right? We really do use it to connect to the business strategy. Next slide. We also were able to win the Great Place at Work, which is a separate certification that you do. And then also last year, with our Gallup scores going up, we won the Fortune Best Workplace for Aging Services in 2021. So again, some more validation that some of the things that we're doing as an organization are working well. Next slide. this is just, we have to have fun. We work really hard and we have to have fun. So these are some of our other HR team members that couldn't be here today. And, as you see, our Zoom, sometimes you got to get a little goofy, right? And this is how we stayed sane in making all of this happen. Next slide. Any questions? And like I said, be happy if you wanted to reach out to Scott, if you wanted to have a conversation with Adam, Jean, or I, we can email and reach out and have a conversation if you like. But if there's any questions now, we'd be happy to help out and answer anything that you want to ask.
Beth, thank you so much. And I did have a couple follow-up questions about the, I guess, you were saying how the HR team has been sort of upgraded and in terms of learning as a team and potential staff members that were added. Tell me a little bit about the executive team, the top people on your, not just HR, but your whole executive team. Like what were some of the, were there improvements in the executive team, or did they parallel HR, or were they the same as they've been for a long time?
No, I actually think that different timelines, right, and different ways of how they have improved or made changes, but the entire organization, I think, felt that. One of the things that we also did, the culture index that I mentioned that I used as assessment for HR, all of our chief leading, so our top 30 executives went through that and took the culture index and then was able to start evaluating their people by that and actually hire purposefully by that. So that's a tool that we used as an underpinning for just, know your people better, know your team better, make sure that you have the different skill sets, right? Like Adam, Jean, and I know what we're good at and what we're not good at. So when I have things that I'm not good at and I need help, I know who to reach out, whether that's Adam's skill set or Jean's or one of our other team members. We all consciously are aware of that, and the organization is aware of that as chiefs. So it really does help with collaboration, teamwork, and just having a basis to say it's okay to talk about these things, right? Because not everybody's good at everything, right?
Right. That's fantastic. Well, listen, we are winding down here. So just a couple of kind of closing thoughts and comments. First of all, I didn't hear any laundry machines going. So that was a big accomplishment.
That was a big win.
Yeah, big win. But no, seriously, thank you guys. Really impressive presentation, insights. I can see why you guys did win the award. You should be very proud of your team. And it sounds like the leadership of the HR team is just very progressive and just like I said, a very, very impressive presentation. So we are going to send this out with your permission to a wider HR audience to see if they can, have a chance to take a look at this. I think it's definitely worthwhile for people to understand, why you guys chose to apply for the award and what sort of the best practices were that led to you winning the award. So with that said, I'm just going to kind of wrap up with a couple final thoughts. The applications for the award, again, are due on August 26th, which sounds like it's a long time away, but many of our potential applicants are already starting to think through and plan what awards they're going to apply for. And we encourage you not only to apply for the HR department, but we have great excellence categories, including, technology and wellness and compensation and benefits and talent management. So the website again is hrawards.org, hrawards.org. The finalists will be announced on September 15th, and the award celebration will take place on November 9th. If you have any questions whatsoever, you can reach out to me directly at scott.rosen@rosengroup.com, and I'll be happy to answer them. And so that's really it. We're a wrap. Again, Bet, thank you to you and your team. Thanks to all of the sponsors, including Kelly Benefits and Comcast Business. We really appreciate your support, and we will see everybody soon, and have a great day.